When the FDA expanded its recall of a popular heart drug today, many people were concerned.
Health officials issued the most recent call of valsartan because some of the products may contain a potentially cancer-causing chemical. At one local pharmacy, medical reporter Meg Farris found a steady flow of patients eager to switch their prescription.
In Old Metairie, Majoria Drugs is inundated with people returning unused high blood pressure medicine, even one who works there.
We had 2 bottles of unused medicine because we had just gotten our prescriptions filled when we heard about the recall, so we brought those back to Majoria's.
And she's seen the many concerned customers.
A lot have been hearing in the news and kind of panicking about it. They think that the medicine is causing them great harm, that it could be poisonous.
The pharmacist quarantined the many returned bottles and is replacing the unused pills with uncontaminated lots or with different high blood pressure medicine prescribed by their doctors.
They're worried about the cancer risk that was associated with it. They're worried about not having medication to control their blood pressure.
The FDA says certain lots of valsartan picked up a byproduct contaminant when the manufacturing process was changed a few years ago in China. The risk of that causing liver cancer was shown in laboratory rats to be extremely low.
Valsartan can be life-saving because it lowers blood pressure and it protects against heart failure.
So Tulane cardiologist Dr. Keith Ferdinand says in the time it takes you to change out your prescription, do not stop taking the one you have.
We're looking at hypertension and heart failure. These are very serious conditions. And just stopping your medicine and throwing it away is probably not the best course.
In the meantime, pharmacies that had no role in the contamination are unsure how and if they'll be reimbursed by the Chinese manufacturers for all the return pills and the new higher-priced safe ones that they're replacing them with.
So a product that may have cost 30 cents is now costing $30.
Meg Farris, Eyewitness News, Medical Watch.